Question is often asked, what kind of facelift is needed? And many people today are inquiring about a deep plane facelift. So what we want to talk about are the indications for that particular procedure. But first, let's talk about the difference in a deep plane facelift and other kinds of facelifts. Your standard facelift that we had many years ago was mainly the doctors were just going under the skin and pulling on the skin. And then about 4 decades ago, the doctor started lifting the underlying fascial layer. And then after that, later, that they learned that if they went under that fascial layer, they could get more movement in the cheeks and the jowl areas. So some patients don't need the deep plane lift, but if certain areas of the face are sagging, then that's when we need to consider that procedure. Now, it's an easy procedure to do for the patient to go through. It's a very natural look. It's a very strong lift. Of course, nothing will stop aging, but a deep plane lift is really a good technique, and it's nothing extra that the patient really needs to have a lot of concern about. But what a deep plane lift is we're getting under the muscle and the fascia layer that comes out further in the face, and we free up some of those attachments under there that's holding that fascial layer down, and that fascial layer is really what's sagging. Now, of course, we get excess skin as we age, but it's the fascial layer that's coming down underneath the skin that we need to lift up to get that good, strong, natural lift and to extend it out into the cheek. So if a patient has a lot of sagging out in this area of the cheek, deep plane lift is going to help in that much more than the other kinds of lifts. If they're sagging more out, way out in the mid cheek, again with these lines, that's going to help with that more. Nothing will get rid of the lines, but it does help to get substantial tissue movement up in this area of the face. And in the jowls too, it can really lift those jowls up in the correct direction and with the correct strength and the correct movement to get it up as much as possible. Now, there are risks with anything, but the risks with this are fairly low. But this is a good technique to use for those patients that have extensive sagging in the upper mid cheeks and the jowl areas, as well as down in the neck.